I'm Petra, a 40-year-old woman. Though I've been married to my husband Floyd for 10 years, we don't have children, which leads my father-in-law Kevin to call me incompetent. My mother-in-law Sandy, who has passed away, also looked down on me for not being able to have children, and always had a snide remark. It's true that many people have kids after getting married, but there are also many who can't, despite their wishes. I wanted kids too, but I was diagnosed with infertility, and there was nothing I could do. I even underwent treatment, but it was ineffective, and it just cost money and time. On top of that, it was a mental and physical burden, so I stopped after 5 years. Ever since, we've been living as a couple without children. Hey, long time no see. It's been a while. By the way, I heard Dad went to France recently for a conference? Yeah, I presented my research findings. Everyone listened intently to my speech. That's Dad for you. You're really something. Haha, you think? Well, you've been pretty busy yourself lately, haven't you? That major surgery on the leg of the president of that big construction company? Oh, that wasn't a big deal. With me handling it, it's a 2-hour job, easy. Impressive. That's my boy. When I visited Kevin's on a holiday, my husband and Kevin were both deep in conversation about their work and really enjoying themselves. My husband is an orthopedic surgeon who seems to excel at operations, and he was quite pleased being praised for a recent surgery he did on a company's president's leg. Kevin is a university professor researching cutting-edge technology. He always says he's an elite, and being a professor at a prestigious university, it's not surprising he has an elite mindset. However, sometimes his attitude is a bit too much. It gets irritating. He looks down on me because I'm just a medical administrator and doesn't hesitate to make unpleasant remarks. Petra, your job must be boring, right? Not leaving any significant mark, just doing the same thing every day. Doesn't it get to you? No, my job is quite varied. Well, it must vary with different patients coming in, but it's just paperwork, right? Checking documents like those receipts, they seem simple. Poor you, unable to land a top-tier job like ours. Anyone can do medical admin work. I would hate doing such a job every day. Is that so? Yeah, a job like that suits an incompetent wife who can't even have kids. We're on a different level of living. The elite chosen ones. Yeah, right. We're like gods. Exactly. Both Floyd and I are top-notch in our fields. Floyd and Kevin were laughing loudly and clapping their hands. Not understanding what was so funny, I stood there frozen. Though my husband and Kevin had always had some questionable morals, this level of outright disrespect was new. I was brimming with retorts, but I held back. Such people would eventually get their due, I thought. Best to leave them be. Despite knowing I despised smoking, Kevin deliberately lit up a cigarette indoors and exhaled in my direction. I have asthma, and his actions could easily trigger my breathing trouble. It developed in my childhood and hadn't bothered me much as an adult, but this time I started coughing. Please stop. My bad. Wasn't on purpose. Really, this is too much. Nothing beats smoking, eh? Several months later, we received shocking news. Kevin had fallen ill, and both my husband and I were taken aback. It turned out Kevin had esophageal cancer. His heavy drinking and smoking were likely culprits, I figured. Not all esophageal cancer patients are heavy drinkers or smokers, but the risks do increase. Considering Kevin's 6 beers a day, plus wine and 2 packs of cigarettes, it wasn't a surprise. It started with just a feeling of something stuck in my throat. Cancer, though, I never imagined. That's terrible. I have things I need to do. I can't die. I have to see my research through to success. Dad, you're going to get better, I promise. Soon after, Kevin was hospitalized. Kevin was quite frightened because he needed surgery. He said he had never been seriously ill since he was born, and of course this would be his first surgery. Dad, you'll get better, I promise. Ah, thank you. See you later then. You can go back, Petra. Floyd will stay with me. Yeah, leave. You're of no use here. No. Take care then. My husband had the day off, so he came along for Kevin's surgery. He seems to have gone outside for a distraction. I changed and entered the operating room. I wasn't scheduled to work today, but the assigned surgeon fell ill and was admitted, leaving me no choice. That's why I was chosen as the stand-in. Hello, I'm Dr. Loveridge. Are you feeling okay for the anesthesia? Yes, I'm fine. That's good to hear. By the way, where's Dr. Statham? Dr. Statham was suddenly taken ill and admitted earlier. I believe you were informed. All right, sorry. No problem. You must have forgotten in your nerves. So, today she will be the one operating. What? Hello, Kevin. I'll be performing the surgery. Wait a minute. Please proceed with the anesthesia. Okay. Kevin seemed like he wanted to say something, but he was put under before he could speak. Once the anesthesia had fully taken effect, I began the surgery with the seasoned Dr. Loveridge. Scalpel. Forceps. Nice technique with the scalpel. Dr. Petra, you're truly a specialist in esophageal cancer, aren't you? No, I wouldn't say that. Now, I have to keep pushing on. Suction. Thank you. Scalpel. Yup, that's some fine surgical skill. Kevin's surgery was a procedure known as an esophageal bypass. Quite a challenging one. I was performing it, and Dr. Loveridge was offering praise. Dr. Loveridge is my superior and a professor. Being in a teaching hospital, Dr. Loveridge is a veteran gastroenterological surgeon as well as a professor. As for me, I'm not a medical clerk at the university hospital. I'm an associate professor. Eventually, we managed to successfully complete the surgery. Sitting on the bench waiting, my husband looked at me in surprise. You performed the surgery? Yes, I was called in as a last-minute replacement. You! Didn't I tell you to keep your identity hidden? Now Dad knows. What's the harm in him knowing? Keeping it hidden feels foolish anyway. You can't follow what I say? You really are something. Saving a patient's life should come first. There was no one else available for the operation. The original surgeon fell ill and was admitted to the hospital after all. Before we got married, my husband always told me to lie. He said that because his previous wife left him. In other words, my husband had a history of divorce. His previous wife was also a doctor and quite competent. Apparently, she was much more accomplished than him and had been abroad for research. He didn't think highly of that, often saying things like she was too arrogant for a woman. His ex-wife tried to value their home life, but gradually their relationship soured. She couldn't endure his insensitive remarks any longer. Having reflected on this, my husband intended to cherish his next wife. After marrying me, he was kinder. However, he asked me to disguise my profession. If it gets out that I married another female doctor, Dad will surely have something to complain about. Yeah, right. So please lie that you're a medical clerk. That way I can protect you. But that's... Got it. I want to be kind to you. That's why I don't want to hear anything from Dad. And you should listen to me from now on. Okay, I understand. So I did as my husband said and lied about being a medical clerk. But he didn't treat me kindly. His attitude grew worse by the day. He disliked being woken up in the middle of the night for surgeries, and I started to think maybe marrying a female doctor wasn't for him after all. He grew even colder after I became an associate professor at the university hospital. Despite his words about protecting and being kind to me, he started saying I was too arrogant for a woman. I felt it was the same treatment his previous wife had received. Feeling fed up with such a marriage, that's when Kevin was diagnosed with esophageal cancer. Kevin seemed to have woken up from the anesthesia. When I visited Kevin's room, he looked at me in surprise. "Weren't you a medical clerk?" "No, I'm an esophageal surgeon. I work here at this hospital." "Well, I'll be. I'm sorry for suddenly having to perform the surgery. Statham was admitted with appendicitis." "So that's the case. Well, can't be helped. My surgery was quite complicated, wasn't it?" "You were able to handle it?" "Yes." "How do you feel upon waking up?" "Dr. Loveridge. Well, there is some pain, but it's not unbearable." "That's good to hear. It's regrettable Dr. Statham couldn't make it, but you were in good hands with Dr. Petra." "Huh?" "Dr. Petra is, after all, a specialist in esophageal cancer. A promising young talent in the field." "She's a specialist?" "Yes, Dr. Petra is somewhat a protege of mine. Truly exceptional since her residency days. It shows she's a Harvard Medical School graduate." Harvard Medical School, as in Harvard University's Graduate School of Medicine?" "Yes. Before joining this hospital, Dr. Petra studied there and worked at other institutions." Kevin seemed surprised upon learning of my educational background. I am not only a physician, but also a graduate of Harvard Medical School. However, my husband had instructed me to keep that a secret. Kevin himself was a graduate from a fairly well-known national university, where he went straight on to earn his PhD and became a professor. Yet, it seems he harbored an unusual sense of rivalry towards anyone from a more prestigious and reputed institution. He appeared to be a bundle of complexes about academic credentials, constantly criticizing various universities at any chance. But deep down, he probably envied them. That's why he would make statements like this. "I could have gotten into Harvard myself, you know." "Really?" "In the mock exams, I scored well enough to pass with ease." "Is that so?" He wanted to believe he was an elite, always boasting that he could have been admitted to Harvard. I don't think being from a famous university makes me superior, nor do I look down on people from other schools. But saying that in front of Kevin would lead to a huge fuss, so I kept silent. Moreover, my husband had told me to hide my alma mater. After all, women from private universities or junior colleges seem more charming, right? So just say you graduated from a junior college in front of Dad and the others. But I won't be able to answer if they ask me about it, and they'll find out soon. Just wing it, it'll be fine. I want to protect you. I don't want to see you getting sneered at. It's better this way. Is it though? Yes, so just do as I say. Then they'll think of you as a good wife. Pretending to have a different academic background wouldn't have made me a good wife in their eyes. I had been called incompetent, complained about to my in-laws for various things, such as my cooking being poor or my cleaning not thorough, always finding fault. And the worst of it was being berated for not being able to have children. Dad, you're awake? My husband had come to, approaching us. He seemed to have been at the kiosk buying drinks. Sorry, Dad, I kept quiet. This person is a doctor. Yeah, I heard that. But, you know, she's just a clunker, way beneath me. Huh? I'm recognized as a competent doctor by everyone, but this woman is just a low-level physician. Her surgical skills are worse than mine. No, wasn't she a specialist in esophageal cancer? Well, that is... You went and married another doctor without telling me, despite me telling you so many times to quit being a doctor. Well, that's because... And what's more, this woman apparently graduated from Harvard Medical School. We're losing in terms of educational background. Aren't you ashamed that you have a lower educational level than your wife? No, but look, doctors do have a high annual income, right? So she's got high value in that sense. What? My husband blurted out something outrageous. High value? What's that supposed to mean? How much more does he plan to belittle me? I also followed my husband's lead and hid my own background, so I felt guilty as well. Doing everything he says feels stupid, but it seems he thought of me as just someone convenient to bring in money. Petra, it's out now. We should apologize to Dad. No, I won't apologize. Why should I? Because it's like we've been deceiving him. That may be true, but it's not like I've done anything wrong. In fact, I've been performing surgeries to save lives. But Dad is angry. I won't protect you anymore. Have you ever protected me? Since we got married, it's been nothing but belittlement. I don't want to be with someone like you anymore. It was stupid to continue such a ridiculous marriage. Wait, I need your earnings. Excuse me? I failed in real estate investing. What? Please, I'll go bankrupt at this rate. Oh, really? Not my problem anymore. I must have some sort of magnet for attracting such flippant and worthless men. It's been that way since I was a student. There must be something about me that appeals to such men. I deeply regret it, but I can't get back the time I've spent with my husband. Thinking of divorcing such a person, I thrust the divorce papers at him. Thanks for all the mental anguish. Now I can claim compensation. Don't say that! We're a couple, aren't we? I never felt like we were a couple because you always belittled me. I never felt loved. That's not true. I gave you advice for your own good. That's why your previous wife left you. You're not suited for marriage to a female doctor. And I was never compatible with someone like you. That's all there is to it. And so I divorced him and claimed compensation for mental suffering. The ex-husband had lost a lot in failed investments, but he paid me with the little savings he had left. Kevin, it seems, got discharged but didn't follow the doctor's orders, frequently smoked, and drank heavily. That led to a worsening of his condition, and he passed away without much trouble. Had he followed the orders, maybe he wouldn't have relapsed. My ex-husband, he said he was sued for a medical error. He worked at a different hospital, not the university hospital where I work, and it caused a major issue. People like that are so preoccupied with cutting corners and so full of themselves. It's no surprise they end up this way. He might not be able to make it as a doctor anymore. I'm really glad I divorced such a person. I'm single again, but now I'm throwing myself into my work, and I'm enjoying every day.